Hi, my name is Willie Garcia. I'm a registered medical assistant through American Medical Technologists. I have about 8 years experience in the field, and today I'm going to show you the proper way to draw blood and label your specimens. Consider this more a crash course. I'm going to show you the very basics of phlebotomy, which is the procedure medical assistants, phlebotomists, nurses, and some doctors use to draw blood for specimen testing. I'm also going to show you how to properly label a tube, and I'm going to do my best to explain why we do all of these actions. I know this is a video training. I wish I had people to have around me to ask questions, so I'm going to do the best I can to explain. If after this video you, the viewer, have any questions for me, I'm happy to make another video with an explanation. So first things first, let's talk tools of the trade before we begin. We're not actually going to draw blood today, but I'm just going to show how we're going to do it. I don't have the actual tools with me. I do have a classic syringe for a syringe draw, which we can get into that later. But for right now, these are the tools of the trade that I'm going to break down in 3 steps. The first step is the vacutainer, which is capped on both sides. The reason for that is the top cap, it protects the needle, protects the operator, and of course keeps it sterile. The bottom piece is the capped rubber sleeve. Inside the rubber sleeve is another little needle. It is what pierces the SST tube on the top here, and it allows the blood to be placed into the specimen container. Usually, what will happen is the vacuum that is inside this tube will actually suck the blood out through the the needle in the rubber sleeve, thus actually allowing us to contain the blood in the tube, and it will automatically stop once the tube is filled, which is really nice. So going back to what the vacutainer looks like, it's one of 2 pieces, and that's where we go to step 2. Once you take the top cap off of the vacutainer, you'll see the needle, and you'll have a safety. Now the safety, never click that with your finger. The only time you're going to click the safety is if there's a defective issue with the vacutainer, which rarely but does happen, or you're done drawing blood. How you're going to snap this back into place is you're going to place it on the counter of a table, and you're going to use the safety of the hub to actually close the needle, and the needle will actually, the safety will actually go up, and it'll seal the needle, rendering it safe, so you can place it into a sharps container or what have you. I also noted the bevel. The bevel is the sharp, let's call it like a slant in the needle. The bevel should always be pointing up. The bevel is like a little hole, and the pointed edge should always be towards the area that we're going to be drawing blood. Just think bevel up or level up, like video games. Now if we go down here, we see the rubber sleeve uncapped. It literally just looks like a little rubber finger. And this here is the hub. The hub is going to connect to the rubber sleeve. Now this middle part here is like a screw top. Same thing with the hub. The hub will allow itself to slide through the rubber sleeve and be twisted onto this section here, so that the hub can be connected to the vacutainer, creating step 3. Step 3 as a whole, the vacutainer the vacutainer hub should look like this. The hub is what you're going to be holding onto the entire time. It's your safety. It's what keeps your fingers away from the needle. The hub is also used, to house the reservoir and give you a little bit of stability with the SST tubes. So I'm using an SST tube as an example. There are a lot of other tubes out there. There are lavender tubes with anticoagulation stuff inside of them. Same thing with there are green tubes with heparin and so on. But we're just going to focus on the SST tube today for a metabolic panel, which is a very basic, very common test done in the field. So before we get to the blood drawing part, let's just say in hypothetical, we're already in the vein. we're holding onto the hub, and we're placing the SST tube into the hub. What's going to happen is when you push the tube into the rubber sleeve is actually going to move back, exposing the needle. The needle will pierce the top here, and the vacuum will actually begin to suck the blood into the tube. The serum separator gel. So when the blood is in the tube, and we've removed it from the hub, and it's just the tube by itself, we invert it about 5 times so that we can safely mix anything that's in this tube with the blood, and some of the serum separator gel, like the stuff that's in there, it gets into the blood as well. I know that sounds a little bit off, but once you spin it into the centrifuge, this gel actually will raise and will split the blood platelets and the serum, allowing the serum to be poured off and easily tested. So that's why we use SST tubes in the field. Because the majority of our tests, we use the serum. We do use the blood, like for complete blood counts or point of care A1Cs. But for tests like metabolic, HIV, lipid panels, things like that, we use the serum, which is it's kind of like a yellowish clear plasma. It's pretty neat. So we'll get to that point next. So these are the tools of the trade. We're going to go through it again. This is stage 1, where everything is capped, the capped needle, the capped rubber sleeve. This is stage 2, without any of the caps, exposing the needle, the bevel, the safety, the rubber sleeve, and its front, the hub. And this is stage 3, with everything combined and ready to go. Needle, hub screwed on to the rubber sleeve, safety, and then the tube ready to go. Okay, let's move on to the next. So now that we've learned about the tools of the trade, I'm going to teach you about setting the stage. Now, what I mean by setting the stage, I mean before the patient comes in, it's very professional for the medical assistant or the phlebotomist to have their tools ready. It's actually very helpful, especially if you work in a high-paced setting. In my experience, there have been times where I've had to draw anywhere between 60 to 100 people in a day. It gets pretty hectic, so it is really nice to set the stage. In order to set the stage, try to have a sterile tray near you, something that you can carry. You can have the following tools with you. Almost every clinic or hospital has these tools on hand. If they don't, of course, speak to the supervisor, but most of them will have these tools on hand, and they're very simple and they're very straightforward. The first one is gloves. So gloves are very important. We don't want to get blood on our hands. We don't want to get any serum. We basically want to keep ourselves as clean and safe as possible. Treat every patient that comes in as a high-risk patient. Whether they're high risk or not, doesn't matter. Treat them as high risk, glove up. Always glove up. The next one is, and if I'm spelling any of these wrong, I do apologize. I don't have the Microsoft Word on me, so I'm just kind of freehanding all of this. The next one is tourniquet. So what a tourniquet is, it's the band that they place on your arm to tighten the arm. It's like a big rubber. It's a big rubber band, basically. And the reason for this is so that it creates pressure in the veins before you draw. This makes it very easy and very doable to actually draw blood. On top of that, it also plumps up the veins so you can actually feel it better and see it easier. Never go by just sight alone. You're always going to have to feel for the vein. I want you to keep that in mind. The next tool we'll need is cotton balls, or some kind of something dry, something sterile and dry. Cotton balls are most common, and we use the cotton balls to stop the bleeding in the wound. So those are very useful. The next thing, of course, you need to have your venipuncture or vacutainer kit, and it'll be the vacutainer and the hub. And that was regarding what we spoke about earlier, just setting up the hub, and that's what that tool is, the tool you're going to use to actually draw the blood. Of course, you're going to also need alcohol wipes, which we use to clean the area that we're going to be performing phlebotomy. This is very important. You don't want to just stick a foreign object into someone without cleaning the area. When we put a needle in someone, we also bring in whatever bacteria or whatever is on top of their skin. So that's why we use the alcohol wipes to really clean the area. Once you clean it, I do a simple wipe from top to bottom, and then that's it. I let it air dry. I don't blow on it. I don't do this hand gesture motion. I just leave it as is. The next thing is Band-Aids. So we have Band-Aids for the obvious. Once the cotton ball has held the wound closed, just put a Band-Aid on top to hold everything nice and secure so that people don't bleed out pretty much. So these are just a few things setting the stage. There is a couple of safety things I want you to keep in mind. So we'll add a little box here. We'll call it safety. And the reason for this is there are people who, and I cannot stress this enough, there are patients who come in that are terrified of getting their blood drawn. Get to know your patients, because even I myself am known to faint. If someone does something incorrectly, if someone does faint, do not panic. Have a couple of these, have some of these tools to help you out. Access to fresh water. This one is important before and or after the blood draw. If somebody comes in and they say they're really dehydrated or they're just really hard to find their veins, offer them water. A lot of the times they are just dehydrated, and when you offer somebody water, it's actually plumping up their veins. It's very beneficial to us. If someone passes out, once they begin to regain consciousness, again, offer them water just so they can have something to help them out, preferably something cold. The other thing to have is an ammonia stick. If you've never smelled an ammonia stick, I promise you, if you are in the process of passing out, if you break one of these open and put it near someone's face, they will not pass. They will more than likely not pass out. They may still pass out, but these things are very powerful, very aromatic. They're meant to wake you up. It's kind of like a slap in the face of ammonia. And then one of my favorites is hot and cold packs. Now, here's the reason for this. The cold pack can actually be used in the back of the neck for people who are prone to passing out. A lot of patients will tell you, hey, like I'm known to pass out. And the cold pack behind the neck is kind of like a distraction. Kind of like it kind of cools you off because you're sitting down and there's somebody with a needle in front of you, and you're just your fight or flight response is going, your blood is pumping. So when you're able to just kind of add that cool feeling in the neck, it kind of calms you down a little bit. And if someone does manage to pass out, sometimes that cooling feeling in the back of the neck does help. The hot pack, the reason for that is if someone is really difficult getting their blood drawn or just finding their veins, you can place a hot pack in the antecubital region of their arm, which the heat will actually bring the veins to the surface of the skin, allowing you to find the veins a lot easier. If you're unfamiliar with the antecubital region, that is the topic of the next discussion. This is a rough sketch of an arm. So where to draw, and by that I mean where to draw blood. So imagine that this is an arm. Up here is the bicep. This is the elbow. This area is the forearm. And this is the antecubital region. It's the crease of the arm. If you need more of an example, it's that part that bends. That's where we're going to be drawing blood. So when you're palpating, the term palpate means grabbing two fingers and just kind of feeling. What you're feeling for when you're looking for the vein is kind of like if you were to push on like a rubber tube. You push in and it actually bounces back, and it's a little bit bouncy. If you don't feel that bounce, then you're probably not feeling the vein. If you feel something really hard that doesn't bounce back, that's not the vein. So just be very sure. You feel that bounce, you feel that feeling of like a rubber tube. You can kind of play with your own veins with this. Sometimes the veins are very thick, so you can really see and feel and get a better idea of where you're going to draw. Other times, especially with pediatrics and the geriatric community, the veins are a lot smaller. They roll around a lot, so you really gotta be patient. This is an art. You're not always going to get it. You're not always going to find it, and that's fine. The point is to be as safe as possible and not traumatize a patient. And of course, yeah, you want to succeed at this, and it's just something that's going to take time and practice. And until you've gotten enough blood draws in your time as a medical professional, this is just something that's going to be trial and error until you master it. So hopefully some of this information will help you get through and master this a lot easier. So now that we've covered tools of the trade, setting the stage, and location of where to draw, we're going to talk about what's next. So you have your field set up, everything's ready to go. Now you're just waiting for the patient. So depending on your clinic, you might have patients that just walk in. You might have a patient who has an order. We're going to go with the easiest explanation for now. If a patient comes in without an order, there's a chance that in their file somewhere there might already be an existing order, or there might have been mention of a doctor wanting to put in orders, in which case you would just go to the doctor, ask them to print out the orders for you, or if it's Epic, you can just release the orders yourself, assuming you have permission. But let's just assume for now that the patient is in your office, and the patient has a physical order. They go up to you, they give you the order. So just have the patient have a seat out in the lobby, or you can have them sit in the lab, whatever you're more comfortable with, and you prepare the order. So the order reads metabolic panel. It's a basic metabolic panel. So you've never drawn for that before. How would you know what tube to use? So what you're going to do is most labs and most clinics have some kind of testing catalog. Some labs and clinics, they will use particular labs. So to name off a few, LabCorp, Quest Diagnostics, Providence Lab, Legacy Lab, what you can do if you have a question regarding a test is you can actually get on that company's website and you can put in test catalog, like Google Providence test catalog. I actually do this quite often with Providence and Quest Diagnostics. I use them both as a reference. It'll give you a search engine. You put the name of the test on there, and it'll tell you the reason for the tests, what kind of tubes you can use, what you shouldn't do, and important temperature storage. And there are some tests that are like light sensitive. That's another thing that the test catalogs will tell you. Like if some tests are light sensitive, or if they're only good for 24 hours, and so on. So off the top of my head, I am aware that a basic metabolic panel room temperature will last about, I want to say 3 days to a week. In the fridge, it can last up to 2 weeks, and in the freezer, just the serum, I think it could last a month, but at that point, you might have some irregularities with, I want to say it could be the glucose. It's been a while. But you can double check that with the lab catalog. So, all right, let's say you check the lab catalog, you see that the metabolic panel requires an SST, or a serum separator tube. How do you distinguish which tube is a serum separator tube? You have a bunch of tubes in front of you, all multiple colors. You have greens, blues, yellows, tiger tops, you have purples. So you read on the test catalog. It tells you yellow top or tiger top. The difference between a yellow and a tiger top is usually just size. That's it. They're both serum separators. I like to use the tiger top just because I like to have a little extra serum in case the doctor likes to add on tests. I've worked with a lot of doctors that love to add last minute tests. So I like to prepare for them. You can go your own way on that one, but I prefer mine. So you now know which tube to use. You have your entire setup. You have the patient's order. On that order, there should be at least, and this is very important, at least 3 patient identifiers. Now, why 3? Because of your John Smiths and names that are very common and birthdays that are very common. Do you know how many John Smiths were born on February 27th, 1972? That live in the state of Oregon alone? There's a lot. There's a handful of them. So you use a third identifier to distinguish them. That third identifier can be an address, can be a phone number. Some people use the last 4 digits of the social security number, but I use that as a very last case scenario. I would rather use the insurance group ID number or something like that before I use the last 4 of the social security number. That's a lot more, this is something I prefer not to use unless I have to. But that third identifier is very important. Even if the name is something not as common, always have a third identifier. Always cover yourself. Think about that. Always cover yourself. That third identifier will help you out. And once you have those 3 identifiers, ask the patient. Don't read off what's on the order, because you might be reading off somebody's private information if the order's wrong. Which some doctors, they're not paying attention. They're busy. They hand you the order of another patient. So you ask the patient, what's your name and date of birth? Oh, my name is John Smith, born February 27th, 1971. Cool. I got, this is just what it says in the order. Where's your address? Oh, I live on so-and-so street. Okay, cool. Says here you live on so-and-so street. You're correct. So that's 3 identifiers. You checked to make sure John Smith's name is John Smith, just as it says in the order. You check that John Smith's birthday matches what it says on the order. And just to make sure it's this patient and you're covering yourself, you verified their address. Now, if the address isn't on there, verify their phone number. The phone number isn't on there. Probably have an insurance ID information on there. Verify that. Or, worst case scenario, last 4 of the social, but again, be wary with that one. So, we now have the order. We've verified the patient. The patient is sitting down and they're ready to have their blood drawn. You have all of your tools ready to go. You're excited. You're about to go. And then the patient tells you, hey, I'm scared, or I'm prone to blacking out. This is where you get to know your patient. This is where you have to learn to practice patience and sympathy. Understand that the person that's sitting in front of you is trusting you with their health and is probably terrified. So be very compassionate and understanding towards them. Ask them if there's anything that you can do to try to make them a lot more comfortable. Sometimes patients like to listen to music, so I like to put on like smooth jazz in the background just to kind of calm people. Others like it for you to like it when you talk to them. Some patients don't want any interaction whatsoever. They just want to focus on the task at hand and get out of the way, and don't take it the wrong way. Just do your job, be as polite as you can, and just help them out. So you have to be adaptable. You have to be able to read your patients. So take your time, read your patients. Even if you're really busy, do not traumatize the patient. Do not mess with the specimens. Correctly label them. It's okay to slow down. So now that we've calmed the patient down and we've gotten everything ready to go, now we're going to draw the blood. We're going to just pretend that this is the patient's arm. I don't actually have the vacutainer and hub, so we're just going to pretend that this is the vacutainer part. I'm not actually going to take the plastic off because there is an actual needle in here and it is sharp and I don't have a safety for it. We're going to pretend that this is the hub that's screwed onto the needle. So I suppose if you needed to see what this looked like, if we were to pretend that this is the vacutainer, right here in this part, in this section would be the rubber sleeve. So we're just going to screw this on. Okay, and now that's back. We're going to be using the plunger here as the tube. Okay, so now that these pieces are ready, we're going to look for the vein before we do anything. Before we even get the needle ready, we're going to look for the vein. So we're going to palpate. So just kind of feel in the area, and when you palpate, you can put on the tourniquet at this time to just plump up the veins. The tourniquet is actually going to go in this area. So this is where the tourniquet is going to be. It's kind of like right above the antecubital crease, the antecubital area, kind of on the bicep. It doesn't need to be too tight. Just be wary because some patients will complain. So just not too tight, definitely not loose. So use your best judgment on that. Once you feel that bouncy rubber tube feeling and you're quite certain that that is the vein, That's what we're gonna go with. So we can snap the tourniquet back off, give them a little bit of reprieve. I would grab the alcohol wipe. Let's just pretend that this is an alcohol wipe. Clean the area. Put the tourniquet back on. Give it a second. Okay, now that it's nice and aired out and cleaned, and the tourniquet is on, we are ready to draw. So we grab our needle and we grab it by the hub. And this is a technique called anchoring. Now, what we're gonna do is we're going to place needle right here, and we're going to just anchor. So the way I have my fingers, it's a little bit odd, as you can see. And the reason for that is I'm using the index finger and the ring finger to not move my hand. So you can use the pinky too if you want a little more stability. I use my thumb and my middle finger to pinch the hub, and the index finger, if I really needed it to, I can use it to adjust the needle if I have to. So we're here. We're at this stage. We're about to draw blood. So I know where the vein is. I have felt for the vein. I'm ready with my needle and my vacutainer, and you press. Don't hesitate. Don't go slow. Don't go too fast. Don't jab. Definitely do not jab. Just go. It's a very sharp needle. It goes in like butter, I promise you. And you do not need to go that deep. Just, you have to use your best judgment on this. This is one of those things that you're just gonna have to learn with time. So now that we're in, comes the tricky part. So I'm gonna place this down. We're just gonna assume that my hand never left because I'm using my left hand to film. This is a mock tube. So we're just gonna pretend this is the SST tube. So while this is drawing, we're going to place the plunger back into the syringe. And then we're just gonna push the tube in. And then by this point, it'll pop the rubber sleeve. The rubber sleeve would be like in this general area. It'd be sticking out. It pops the rubber sleeve and you'll just see a flow of blood coming through the tube. And then once it fills up, it'll stop. Once it stops, pop off the tube while simultaneously anchoring and keeping everything nice and stable. Once the tube is out, you, with your free hand, grab a cotton ball, put the cotton ball over the wound here, and then just pull it out. With your left hand, you're holding onto the cotton ball, and as you're doing that, you grab a Band-Aid, and then you put it over the cotton ball. So by this point, this is covered with the cotton ball because that's where you stuck them. And then you just put a bandage on top of it, so that way it stops the bleeding. And usually it takes like an hour or so, maybe like 20 minutes to actually have the vein fully heal up. Some people are on blood thinners. Those people you have to be careful with. Make sure that the area is well bandaged. I usually use Coban for patients who are on anticoag medication. So now that we've drawn the blood, we've collected the specimen, and we've ensured that the patient has not passed out and they're okay, they're bandaged, they're ready to go. They're on their way out the door. We have the specimen. Well, what do we do with it? Well, remember the 3 patient identifiers I told you about? You're going to place those 3 identifiers on this tube. The reason for that is the same reason why you had to verify the order and making sure that that is the patient. And it goes back to how many Jonas Smiths born on so-and-so date are in the state of Oregon alone. A lot of them. You're going to label the tube with 3 identifiers, and I know it's going to be stressful and painful because sometimes those tubes aren't big, or there's no bandages or anything you can, or there's no labels you can put on them. You're just going to have to make it work and use your best judgment on it. You can still use an address for the 3rd identifier on tubes if there's not that much room. I prefer to use the phone number. Sometimes some clinics will let you use the last 4 of the phone number, which I don't mind doing that. And again, the reason for that is the reason for the 3 patient identifiers on the specimen tubes are if you're working in a high pace setting and you're just drawing blood all day, if you forget to label one of those tubes and you put it on the rack or you put it in the centrifuge, and it's spinning with a bunch of other tubes, maybe you forgot to label more than one. You don't know. Well, whose blood is that now? Exactly. You don't know. 3 patient identifiers. You may also run across 2 John Smiths in an hour. This has actually happened to me. And you always go to that 3rd patient identifier to make sure that that's your John Smith that lives on ABC Street versus John Smith from CBD Street. So you have to be really careful, and that's why I really stress the 3 identifiers on the tubes. And I don't care how busy you are. I really don't. Slow down. There's been too many occasions where I've caught fellow staff, mix and jumble lab test specimens, and that's very important. That can get you fired, for one. 2, that's someone's livelihood. Ask yourself if you'd like someone to mix the names on your tube, and I don't know, they tell you that, oh hey, your lipids are high, your cholesterol is really high, when the truth is that's not true at all. Or maybe it is, I don't know, but basically it's to prevent like false information, to prevent a false diagnosis. It also protects us from legalities and from getting fired. So there you have it. Today we have covered the tools of the trade of phlebotomy. We covered setting the stage, preparing your sterile field for patients or the patient. We covered where to draw in the antecubital region. We covered the potential patients you might encounter, people who are phobic of needles, prone to passing out, or just plain don't want to be there. And we covered how to draw, as well as proper specimen labeling and the importance of it. Thank you for your time. If you have any questions or concerns, my name is Willie Garcia. I'm an 8-year experienced registered medical assistant, and I'm very proud of what I do. Thank you, and have a great day.